we're discussing this, and thanks to the regional group for bringing it forward, because this is a huge issue. It's not discussed enough, and it's going to become an even bigger issue. As the motion notes, there is likely to be well over 300,000 adults in the state who are suffering from or who have suffered from medical conditions associated with long COVID. That's based on an extrapolation of research done in the Netherlands. And I've seen firsthand people I know who have been affected by long COVID, continue to be, and the debilitating effects of it are really immense. There's obviously a spectrum here in terms of how people are affected, but at the high end of the spectrum it is completely debilitating for people. There was a report done by APC Microbiome Ireland, based in UCC, surveying 1,000 people with long COVID, finding that nearly 70% of them said they were severely limited in their ability to work, while 60% had missed work days due to their long COVID symptoms. 16% of participants said they were unable to work at the time of the survey, and some were sick for up to 20 months, while the median period of illness was over a year. Again, within this general topic of long COVID, the question of long COVID for children, again, isn't discussed enough. I'm sure many of us received a message from Hayley O'Connell, who said, "I'm 11, turning 12 this January, and I have long COVID and ME. I've had long COVID for about a year and a half, and it's not easy. For one, you miss out on a lot of activities like going out with friends or going to the playground because you purely don't have the energy. And it's not just about being tired, it's so much more. It's leg cramps and muscle pain, being so weak, headaches, and there's so much more even." This was avoidable. We must ensure that all children and everybody is protected from this in the future. And in a way, there's two aspects to this, in my opinion. One is to do the research in terms of long COVID and provide the funding and the resources in terms of treatment of long COVID now. So the HSE needs to establish a multidisciplinary public health team to review and manage long COVID. It's vital that that team includes patient advocates, so that the patients, those experiencing it, their voice is included and incorporated. It's a real problem that we still don't have long COVID services for children, and it's a real problem. It's scandalous, bluntly, the rundown that is happening in terms of the matter. It's probably a year or more since I was involved in a campaign, which was thankfully successful, to defend the long COVID clinic in Tallaght, but we just don't have enough of them, and the government isn't taking it seriously, isn't providing the resources. The other side of this question is that the best cure is prevention, and we're still not doing enough to stop people getting COVID. Every time someone gets COVID, there's a real risk, or there's a risk. It's a small risk, but it's present, and then you aggregate it over everybody. Like 10% of people end up with long COVID, something like that. There's a risk that people will get long COVID. And therefore, we need to do now what we should have done 2 years ago, which is to focus in on the central question of ventilation and filtration. It's over or almost a year since we introduced and had passed the Workplace Ventilation COVID-19 bill to give workers the right to clean air at work, which would include, obviously, schools and all indoor public spaces. We do now finally, from last Thursday, have the HSE in opening up a consultation process on its code of practice for indoor quality. It's welcome, but it comes too late for the hundreds of thousands of people already suffering or have suffered for long COVID, and the tens of thousands who will contract COVID and long COVID in the coming winter months. So we need action in terms of ventilation, action in terms of filtration, HEPA filters and so on now.
Thanks, Deputy.